So yeah, you can go for it now.
Perfect. So welcome to our Rig Run Recovery Zone webinar. So my name is Jason. I'm part of the coaching team for Rig Run. And today we have Andy Gordon with us from Aberdeen Massage Therapies. And he's going to give us an amazing webinar, well, we hope, on sports massage. And is it just for athletes? So over to you, Andy. It's all yours.
Thank you very much, Jason. Appreciate it. As Jason said, I'm Andy Gordon. I own Aberdeen Massage Therapies in Aberdeen. A bit about my background, so you know who you're dealing with here as well, is I've been a personal trainer and gym instructor for about 6 years. I don't do so much of that now because I've incorporated that into sports massage therapy at my own clinic, which I've been doing for the last 4 years. I have got a background in anatomy for over 20 odd years though, because believe it or not, I used to be a butcher, but it didn't all include the butchery style of things. It was continental seam cutting with scalpel work and muscle dissection. So I actually know what goes on underneath the skin and of various species, although I've never dissected a human being, thankfully. So let's get started. So is sports massage just for athletes? Before we get into the science of blood flow, etc., generated by massage, here's an introduction to the science versus reality. I'll start with this question. What's your belief of what a sports massage is or involves? So there's many ideas that people have about what a massage is. Some of the ideas encourage people to go for one. Some people are discouraged by what they hear from other people. So for many, it's to fix an area of tension, injury, or tightness, which is causing them problems and often involves deep and firm massage pressure, whether it be from the fingers, thumbs, forearms, or elbows. But there's no rules to say it must be that way as a massage, because it should be tailored to the individual client and include several massage techniques to get the best results. So it's not always going to be deep, it's not always going to be firm, but we'll come into that later on. If you're expecting a one-session miracle cure, please think again, as although significant improvements can be made in a single session, if you keep doing the same things which caused the problems in the first place, don't expect the problems to stay away forever. This is where you need to consider regular maintenance with massage, just like any professional athlete does. When I mention professional athletes as well, a lot of people these days refer to keeping up with their favorite athletes on social media, Instagram especially, and you'll see the image of the person performing or just a posing photograph and things like that. And not often enough does it go into the background of what gets that person to that stage. So whichever chosen field these people operate in, there's a background of nutrition, there's probably a personal trainer, there's maybe a chiropractor, a massage therapist, a coach, psychology. All sorts of things play a part in that athlete or that sports person's background. If you look at that and compare it to what most people do in everyday life, including myself, I've not got a nutritionist in the background or a chiropractor or whatnot as well, but more people should be incorporating it in to get the best out of what they do. But money, affordability, and everything comes into it too. Okay, so there's a big picture to look at, and often it's a good idea to look and investigate behind the image you see on some of the social media feeds as well. So, how can massage help anyone maintain and improve the physical health in the work-life balance of offshore working? Let's start with the time you spend onshore and the lead up to going offshore again. There's maybe two ways to look at this. Some people are fortunate enough not to have any aches, pains, restricting range of movement, no headaches, stress or anxieties, but most people have things going on. And if you swap the words stress and anxiety for thought processes, these are often transferred into your muscles as part of your body's fight or flight coping mechanism. creating tensions in the muscles. So if you've got any history of traumatic experiences in your life, or any euphoric happy moments going right back to when you're maybe under 10 years old, they can sometimes come back in as a little flashback into your head. You've not forgotten about them, they're still there, but these are also transferred into your body to cope with and hold in certain areas, especially if they're traumatic ones. So massage is for everyone, and a sports massage can be adapted to suit the real life situation of the way your body feels. Having a massage before you go offshore helps your body move better and clears your mind of thinking about that niggle you've been carrying with you for weeks, months, or even years. So usually when I get somebody in for a massage, they've filled out a screening form online to save time, so they get more time on the table. But when that person comes in and they sit down for an informal chat, just to kind of put more meat on the bones and place pieces of the jigsaw together, you go back in time to find out what their history is, and what they've been struggling with in previous, like, hobbies, sports and things like that. That's all relevant information. It's like gold to me, because that helps me piece the jigsaw together. And while that conversation's going on, I'm starting to map out where I'm going to start with the body to get the best releases, because you don't always go for directly to the area where the pain's coming to the surface or the restrictions are. Okay, so it's a common thing for people to call up the chiropractor or physio first before considering massage. Massage isn't just a luxury item. Save that for the spa treatments, I think. Sports massage is a hands-on, detailed investigation designed to improve the way you feel and move. In my experience, most good chiropractors will notice improvements in your skeletal system after you've had massage treatments. And a decent chiropractor will suggest having massage treatments as well as chiropractic work to get you back to where you want to be and have even faster results. Because we all want results yesterday. It's human nature, and patience is often difficult to kind of bring to the front there. So patience and effort go hand in hand here. If you're patient and look after your body with massage and chiropractic or physio work, the combination of all these put together is a very, very strong recipe for getting you back to where you need to be. Okay, if you just do one, you might be missing a trick there. One of the things I often explain to people is if they've been to a chiropractor before they come to see me and the results haven't lasted as long as they want to, it's often because there's muscle areas of tightness which tighten up the tendons and pull the skeletal system back to the position of problem. So the skeletal system, whether it's the lower back, mid back, arms, legs, anything at all, knees, if the muscles aren't kept softer, more supple, with a fresh blood flow through them, the tendons and the muscles will start to pull the joint and adjust the skeletal system to make it cope with the way you're treating it. For example, if you've got tight muscles in your legs, in your thighs, that can often pull and affect your knees and can affect your hip. And the knock-on effect from that one can go up your back and into your neck and shoulders as well. It's quite a big range of muscles. It's not just one area, they're all connected, obviously. So the objective of a good therapist is to get you to a place where you don't need to come back for the same treatment time and time again, but to come back because you need to or want to for maintenance massage work. Okay, I don't want to keep seeing people coming back with the same problems, because if someone's not helping themselves outside of the therapy room, not doing the mobility, abusing their body, keep on pushing it without taking any time out, you're always going to have problems. It's a fact of life. So arranging a massage for when you get back on shore too always helps and improves the way your body and mind feels, as it loosens off muscle tensions, helps your body repair, so you can enjoy your time at home more. So if you've got kids, or if you don't have kids, and excuse me a second. So the last thing you want to do is have them leave you behind in when you're getting challenged by them. I know for a fact with my own kids, I want to be able to still keep up with them, challenge them until they start challenging me, but always be challenged. And if you're tight, sore, or struggling with anything at all in your body, it's often a bit of a thought, and you get tired quicker, you can't keep up, you just leave them to go on it and you watch by the sidelines. So a lot of people want to take part, and keeping your body good is how to do that. So on to the next part here. How can massage reduce your risk of muscular injury while working in a demanding environment? Okay, so this is where we look at the science, as muscular injuries are often combated by necking painkillers, anti-inflammatories, or doctor's appointments as a quick fix, which doesn't always address the injury to reduce the injury, the risk of injury happening again. In the last 4 years, I've had clients coming in after being nagged to come in by a partner, a wife, a husband, or whoever, because they've had the same injuries or muscular problems for years. And they want to be taking less medications for it to help them improve their health. And because the people around them are generally fed up with hearing of the same complaints about feeling sore, etc., every time someone comes back on shore or just in sport in general. So here's how it works. For my practice anyway, for the massage side of stuff, and I'm hoping by doing this this talk that it kind of inspires people to go and investigate and challenge a therapist local to them, gets them out of the woodwork and gets them into the massage room to get some fixing done, basically. So I'm trying to give you some tools to kind of take with you and ask questions, and don't just accept what you're told. Ask questions, challenge things, and ask the therapist to, if possible, do a running commentary on certain areas to give you a little bit of a heads up on what's happening with your body. So for my practice itself, here's what to expect, just to give you an idea. So when you complete the online screening form, which I'll send you a link for, well, some therapists, they'll ask you to do that at the appointment on paper, but I usually send a link, because if you do it beforehand, I get to see what you're all about. We expand on it in the room, and it maximizes your treatment time. So you provide an outline of what you're feeling and any muscular or headache issues, as well as your height, weight, and occupation, so that I can advise on a suitable length of appointment for you if you choose one which I feel is too long or too short. So for example, if anyone is over 175 centimeters tall, and they're weighing 100 kilos or more or whatnot, you wouldn't choose a 45-minute session to do your legs, because I could spend 45 minutes or longer on one leg, depending on what we find. We need to get the best results, so that takes time. And what I do is very, very detailed. It's often been described as being dissected without being opened up, because you feel everything as muscles are separated and freed up. Okay, so the screening form starts to paint the picture or complete the jigsaw for me to start your assessment. When you arrive, the informal chat gives us more information, any relevant history. And for example, there's a term I call historic football legs. So historic football legs doesn't have to be football legs. It can be rugby, hockey, running legs, something you did years ago or are currently still doing, and you've not had the proper tools in your toolkit to explore mobility and keeping the legs in your body at its optimal performance by keeping it loose and pliable. So if somebody's played football, say 10, 15 years ago, and their stretching and mobility to do the sport wasn't the best, and then they stop all that and they take up golf or they do something else, and all of a sudden they're getting lower back pain in the lumbar spine. Hold on. So there we go. I've got my stick man here. So the lumbar spine area in the lower back, just above the pelvis. But the problem itself can be originating from the legs. So if your legs are tight or stiff, they're meant to be like mild shock absorbers in your body. So they'll work with the joints and the skeletal system. But if they're not absorbing anything laterally moving or anything impact-wise, they'll go boom, they'll shunt and they'll shunt up into the hip with firmness, like a rod, and then that shunt can engage the glute muscles in your bum to help cope with that shunt, and then into your lower back for the lumbar spine. And there's two muscles either side of the lumbar spine at the bottom called quadratus lumborum, and they're also a coping area or a secondary shock absorber area. So the whole thing happens when the legs aren't loose enough or they're not looked after, or there's history in them where they've not been looked after for years, and it all comes back to the surface, almost comes back to bite you in the bum. So from there, it's all about the hands-on detailed assessment before and during the massage. You're in charge of how things feel, as the signals to the brain and any pain receptors can change the massage completely. With regards to the pressures used during the massage and assessment, this depends on the muscle density which is felt underneath the hands. Any firmer or deeper pressure is introduced gradually, so there's no pain surprises. If you've got thick muscle in your body, wherever it is in the body, some areas are thicker than others, and I start to introduce a little bit more pressure with the thumb or the hand or the fingers, that's because your muscle density and your reaction is telling me I can do it. And the more we get done and the best, deeper flow we get in the oxygenated blood flow, will get you the best releases as well. So as we flow through the massage, the color of your skin can change to a pink or pinky red glow as fresh oxygenated blood flow makes its way to the surface. In simple terms, it's increased blood flow circulation. This signifies a change in the body as we influence the muscles with repeated moves and pressures. It's common to feel a bit of tension through the muscles if they're tight. This can sometimes be painful or have a relieving effect along with the pressure as well. Everyone's tolerances are different, but the last thing you want to do is put someone in distress on the table. Okay, you have to listen to what your client's telling you and the reactions as well. And just for the record, areas of tension are sometimes referred to as knots, but as you usually need two ends to make a knot, that's not possible in a human body. For me, there are areas of tension which need to be smoothed and made healthier with increased fresh blood flow through them. So I often explain what's happening during a massage too, to keep my client in the picture. So it's not just all silence and you're entitled to ask questions, it's your session. You also get a kind of heads up as well on any uncomfortable areas or responses in other parts of the body before they happen. So you get like a little description of what can possibly happen. And then I also usually say, don't feel like you're missing out if that doesn't happen. The signals in the brain can into the body can be different for everybody, and not everybody feels the same thing. Okay. So how do the muscles release? So as pressure is introduced to the body through the hands, fingers, thumbs, forearms, or elbows, the muscle fibers feel the need to defend the muscles, so they recruit all the available muscle fibers to protect the area. The way I describe this to most people is just imagine the fibers are talking to each other like mini humans in your body. They'll be saying, defend, 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 we're under attack. So they tighten up around the pressure being introduced, just like putting the thumb in, increasing the pressure, and all of a sudden the muscle fibers are like, whoa, let's go in and protect that area, we're under attack. So they'll tighten up around the area of pressure that's introduced, but when the pressure has left the area, just take it all off, they're saying, that's better, relax, the attack's finished, release the tension and send in a fresh blood flow, tell everyone to take a holiday or take a break. That's keeping the release, helping to release the tension in the muscles. So as soon as that tension's off, it allows the fresher oxygenated blood flow to flow in and the fibers start to let go. Depending on what you're going through, and if you're dealing with an injury, that can often take a little bit more time, but that's how to really think about it. Just to kind of imagine little humans in your body, and they're all the signals sending messages from your muscles to your brain. Okay, so now we're going to go on to reducing the risks of muscular injuries in a demanding environment. This is very simple because if you've looked after your body with regular massage, your muscles and tendons are more likely to be in better condition with a freshened muscle blood flow, more pliability, more range of movement with less or no restriction, as well as being looser, so they are more ready for the demanding environment. If we use gripping with your hands as an example, whether it's whether you're hitting anything, lifting or moving anything out front, your hands are more or less the visible skilled element of the action. But the muscle usage of doing anything with your hands, especially in front of your body, is transferred through your body, through the upper forearms, upper arms, biceps, triceps, and into your pectoral muscles here in your chest, which feed back in underneath the clavicle bone here. And then that starts to affect your shoulder movement, your arm movement, your neck, and your back. And this can also happen with repetitive desk work or even texting while your posture isn't at its best. For people who use the computers a lot, I just call it mouse arm. You can tell by the tensions and pressures and tightness in the shoulder when you're dealing with that as well to release it. So if you're operating your body with tight muscles, which sometimes you don't even know you have, a lot of people get a surprise about where the tensions are in the body once you start the massage. If it's detailed and you're getting right into the muscles to find out what's going on to get the best releases, some people don't realize how tight their bodies are until they get the signals from the muscles with the pressure that's being put through it. It doesn't have to be heavy pressure. It can be light pressure, medium pressure, just to get the best results. So, yep, if you're operating your body with tight muscles, which sometimes you don't even know you have, there's a high chance of long-term repeated pains, strains, pulled muscles, tears, etc., which can influence the skeletal system by pulling it or influencing it into a troubled or painful position. Hence the popularity of calling the chiropractor instead of the sports massage therapist, when both are usually required. Okay, right. How can massage prep your body for a fitness competition like Rig Run? Well, everything we've spoken about so far is also relevant to prep your body for a Rig Run fitness competition, as well as after the competition, as you will perform much better and recover better with a body that's been had the influences of massage through it. Something else to consider is that if your muscles and tendons are tight, and let's use the legs as an example again, and the hip flexor area, which is the bottom, the front of your pelvis here, where the origin points or starting points of your quads are here. So this area just below your pelvis here, it's tight on a lot of people. So use that as an example. When these areas are full of tightness, they'll actually slow you down, slow down your performance and rob you of your true performance. They'll also fatigue your legs and body sooner than if they were looser, and also burn energy quicker as you're having to work harder than you really have to. And this also applies to the adductors and the inner thighs, the IT band down the side of the leg, on the lateral part of your legs, and the hamstrings in the back of the legs too. So it's amazing how much more you can actually give to any physical exertion, whether it's a competition or not. If these areas are tight, they'll slow you down. If they are looser, if they've been looked after and you're doing some mobility work as well as the massage side of things, that can work in your favor, and you can deliver a better performance, get less fatigued and less tired. And one of the examples I use for that is people who take up jogging, like a couch to 5K or something like that, or whatever, or prepping for a competition like with the Rig Run. If you've not done it for a while, when you get off the sofa and you head out there, you start walking, you start jogging, and you feel just absolutely cream crackered before you know it, before you feel you should be. And you think, oh my God, I've really lost it. I've let myself go. Or this shouldn't feel like this. that's just often tight muscles holding you back. Of course, obviously, there's other things you'd be doing, responsibilities and things like that. So life sometimes gets in the way. I can see we're getting quite close to the end of this presentation. So we've got some a little bit of facts from science. I usually use some of the facts from America because I compare it to how we perform things in the UK, or I perform things in my massage clinic. Massage is more widely accepted as a treatment in America, and quite often a doctor can suggest massage as a possible a part of therapy to get someone back on track with their body, whereas here you hardly ever hear it. So some useful facts. Sports massage techniques are not always deep or painful for athletes or anyone else. They should all be personalized. So you shouldn't be going through the mill unless you really want to go through the mill. And I get some choice language sometimes on my massage table when we do hit some of the high notes or somebody's greatest hits in their body. And as far as I know, there are no massage therapists who claim to be Harry Potter or Dumbledore with a magic spell to fix things in one session. So you have to kind of think, what have I done to get to this position? What's my history like? How long have I had the issues for? Is it realistic to expect everything to be fixed in one session? Sometimes you can get a lot of relief and result in one session. If you give 100% of yourself to the table and to the treatment itself, then you'll get more from it. And that really works quite well. But if you don't, and you hold back and your mind's elsewhere, then you can't expect to get all the good results from that either. But massage itself has been on the go for thousands of years. And I often refer back to the ancient Egyptian times when they used to look after each other and keep each other kind of going. And it's a feel-good well-being factor from ancient times. So times are changing. When it comes to massage, there's more people coming out of the woodwork now. I get more people working offshore coming in to see me now because exactly what I've described. There's a niggle or a pain or something restricting or holding them back offshore, and it's a complete challenge, and it's something you shouldn't have to be going through. You should be able to see somebody about it, ask questions, and see if there's a way forward to make things better for yourself. So also there's evidence which details that 75% of individuals surveyed claim their primary reason for receiving a massage in the last 12 months was medical, to relieve any stiffness, spasm, injury recovery, migraines, or injury prevention. And 61% of those individuals in America, a survey stated their physician or GP has recommended they get a massage. So I'm kind of hoping things change around and develop that way across here as well, because it does make a big difference to a lot of people. But some people have never had a massage before, and it can be a little bit daunting. The best thing to do is send a message, get in touch, ask some questions, and see if it's right for you. Let's see if we've got anything else I can add into that for you. Let's see. Oh yeah. So there's also evidence to prove that massage itself, the lifting and kneading of the muscle tissue, is also known to turn off genes associated with inflammation. So if you have an inflamed area, and it can be identified through massage, and your reaction to an inflamed area will tell us all about it, because if we go across anything inflamed, you'll respond with a bit of a flinch, or you'll vocally tell us what it's about as well. And then we can either do some friction on top of that to put some fresh blood flow through it to help make it, encourage it to recover better. So think about all these things. I think I've covered just about everything I wanted to cover there. Is there any questions at all?
That was amazing, Andy. Lots of information there. That's absolutely fantastic.
Cool.
So we've got a couple of questions for you that have come in. So would you suggest, so we have within RigRun, we have various fitness levels. So would you suggest everyone from the walkers to the ultra runners, do you think they would all benefit from massage therapy?
I think so. It's for everyone, all walks of life, all different backgrounds, all different levels. Even if you're walking, I say even walking is quite a big thing for some people, depending on how far you walk. But there's also recovery. So being able to walk distance, or short distance or long distance, medium distance, you still need to have a fitness level to do that. You still have to have decent footwear to do that. You still need to be looking after your body. And it's the same thing as applies to an elite athlete as applies to the person walking. It's all equal. The treatment is all equal. Everyone gets treated the same when it comes to the process, but the individual therapy itself is personalised to that person and where they're at the time. And it can sometimes depend on how the person's feeling when they arrive on the day.
Okay, so how often would you suggest that we, so someone in their normal training program, how often would you suggest that somebody puts massage therapy into their normal training program?
That can also depend on the condition of their body at the time. If you're good at looking after your body with mobility work, appropriate stretching for yourself, and you're staying active, you may only have one or two things that are going on with your body that need loosened off, or you might just need a freshen up to make sure the blood flow is at its best and the muscles are as loose as they can be. That sometimes doesn't take a whole lot of work. But if there's an issue where something is tight, or the muscle needs more attention, and there's more muscle leading into it or out of it that needs attention as well, if you don't go for the target area all the time and just watch the mechanics of the body, you can actually piece together a bit more looseness and a bit more progress for everybody. So that person who's in pretty good condition, 3 or 4 weeks between sessions. Someone who's got some issues that need ironing out to make them looser, to make them perform better, that can be every week, depending on how you recover. Some people don't have any after effects at all from massage, although they do feel looser, but some people the next day can feel a bit out of sorts. They can feel a little bit tender from delayed onset muscle soreness. Sometimes, depending on what your body's like, there can be a little bit of bruising, and that's not meant to put people off. That's reality. If there's work needing done, I'm not going to wrap you in cotton wool or bubble wrap. The work needs done. We'll talk about it. We'll discuss it together, and we'll get the job done together. So that can be anything from a week to 3 to 4 weeks, but there's no actual time limit on how long that therapy needs to be done. So if someone with issues in their body who needs loosened off, like I said, there's no one session miracle cure for some people. Sometimes it can take a series of appointments, and you have to realize that. And the time spent on the table can be anything from 45 minutes to 2 hours. I do the whole range. It just depends on what needs done. So sometimes people, they invest in a block of 5 or 10 sessions, and there's no rush to use them. We use them as and when they need to be done. And if the job that we're doing together isn't hitting the mark, then I start to figure out, well, what would be best for this person? Do they need to go and see somebody else or try something else? So at the end of the day, it's about getting someone better or feeling better and moving better.
Okay, perfect. And I guess the final question is, when our athletes are offshore, what can they be doing that might assist them? You know, can do things like, I don't know, resistance bands or trigger balls, that kind of trigger point balls, that kind of thing. What would you suggest that people can do offshore?
Yeah, very good question, actually.
Thank you.
That's all right. You don't have to have a massive amount of kit to be looking after yourself either. Say, for example, you are prone to any lower back issues or sciatica, or you've got any kind of impulses going down your legs. Go and research some sciatic improvement exercises, and either download them or get them on your phone or whatever and offshore, and just do them, even though you haven't got the issue. The fact that you're doing something that can prevent something happening in the first place is a big thing. But yeah, resistance bands are fantastic. Once again, it's a very simple bit of kit that can fit in a small bag. It doesn't weigh a lot. You can use it as long as you've got somewhere, a safe environment to attach it to. You can actually test your body and have a decent workout with it. But also the trigger point release balls, I don't know if everyone's seen them or not. They're like lacrosse balls. They're solid. They've not got spikes on them. There's no forgiveness. It's like a big rounded elbow, basically. And once again, if you do some research or if you've been for a massage, I'll show you where to put the trigger point balls so you can get releases just by using a tiny ball, no big equipment, but the more looser you keep yourself offshore, it transfers to back onshore. If you're not putting yourself through the mill offshore and then not looking after yourself at the same time, you're going to suffer when you come back. Look after yourself. Yeah, trigger point balls, they cost about 10 quid for maybe a pack of 3 of them. Resistance bands, they cost a few quid as well, but all really good bits of kit without actually breaking the bank and without taking up too much space or weight.
Yeah, perfect. Andy, that's been absolutely fantastic. That's really informative to everybody, so that's really, really good. Thank you very much for coming online and having this webinar with us on our Rig Run Recovery Zone. So don't forget, everybody, it's going to be posted on the Recovery Zone later, so you can view it later if you want to, and at your leisure, and look out for the other webinars that are coming up in the future. So again, thank you very much, Andy. It's been fantastic having you today.
My pleasure. Thank you.
Cheers.
Thanks.